Canada's healthcare system is one that's celebrated all around the world, but those working in the field say the COVID-19 pandemic is quickly showing cracks in the system, amplifying the need for governments to collect race-based data. For years, medical centers have echoed the need for race-based data collection for many reasons, including to address biases in the healthcare system, to improve the health outcomes of racialized communities, and to address issues that's keeping individuals from seeking medical attention. It's data our neighbors down south have readily available during COVID-19.
We are particularly alarmed by the outcomes for this population. And in particular, now that we're seeing what's coming out from, especially in the US, the Chicago data is terribly troubling.
Helene Gale, the president of the Chicago Community Trust, says though African Americans make up nearly 1/3 of the city's population, they account for 70% of COVID deaths and half of the overall cases. Gale, who's also a physician, says the data shows the burden the virus is having on communities of color, who are already disproportionately affected by poor health, social and economical situations. But the data also shows how the Latinx community is missing, and that's problematic.
Because of a lot of issues, particularly the issue of people who are undocumented, may not be seeking health care, may not be willing to self-disclose what their ethnic identity is, that there may in fact be a hidden epidemic that's going on in the Latinx community.
Earlier this morning, a group of experts participated in a webinar on why Ontario needs to follow suit for not only Black communities, but Indigenous and newcomers.
We'd like to think that this COVID was the great equalizer, but I think if it's done anything, it's amplified the inequality. And I think we are kidding ourselves, those of us who are living in privilege, if we think we're being affected equally by the disease.
Gale says the data collected in Chicago is helping to advocate for equity, creating policies now and after COVID-19 for and by populations who face underlying social and economic vulnerabilities.
It also gives people the opportunity to speak on their own behalves, and getting the data to those communities so that they have the power within their hands to advocate for the things that make the biggest difference in their lives, is critically important as well.
Just recently, about a dozen Black leaders penned a letter to the government detailing this same very issue, as well as the other factors that are impacting communities during COVID-19. In Toronto, I'm Faiza Amin for City News.